All right.
Hello, everybody. Hello and welcome. Hey, Karen. How are you?
Lesli. Good. How are you?
I'm good. I'm looking at my other screen, hoping that, okay. All right. Looking at my other screen for Instagram. You know, they don't make it easy on us, do they? It's not like the old days where you just push one button. Now they have to really make it complicated. So anyway, it looks like we are good to go on Instagram. So I'm excited about that. All right, guys, welcome. And I'm so happy to see you today. Happy Thursday. Happy October. Hard to believe, but here we are. Hello to everyone that's just joining us. Welcome to Live with Lesli. And I'm Lesli Bitel, in case we haven't met, business strategist and mentor specifically for functional nutrition and medicine practitioners in private practice. And again, I'm really delighted to have you here with me today. We have a really hot topic in store for you. So excited. So I have spoken with many of you, many practitioners in my audience, specifically about CGMs and, how to go about integrating the use of especially the new over-the-counter CGMs into your private practice. As we all know, blood sugar is a really super component of the work that many of you do, regardless of your niche. I have clients who have blood sugar control as one of their very first pillars in their program, regardless of the niche. And that would include, fertility, hormone balance, brain health, of course, pre-diabetes, weight management, the list just goes on and on. So we have the expert right here with us today. We're going to talk with Karen Kennedy from Real Food Matters about how you can successfully integrate CGMs, continuous glucose monitors, into your private practice. So what I'm going to do before we jump in is I'm going to read Karen's bio just so you have an appreciation of her background. So as a board certified integrative and functional nutritionist, Karen specializes in helping patients with type 2 and pre-diabetes improve glucose control and metabolic health. And she has been supporting patients using CGMs for years now. And I will attest to that. Before it became popular, so to speak, Karen was out there doing it. And now she trains other providers on how to interpret this data as CGMs are becoming more readily available with the launch of new over-the-counter models, Dexcom Stelo and Abbott Lingo. So yay, Karen, I'm so happy as always to connect with you. How are you today?
Yeah, as I said, I'm okay because I have to pack.
Yeah, you're doing fancy. All right. So give me a comment. Let me know. Are you guys going to Fancy? Anyone going to Fancy? Hey, Monique. How are you, my friend? Oh my gosh. It's been ages since I've caught up with Monique. So welcome. So happy to have you today. Anyone going to Fancy? Would love to connect in real life with anyone that is going. So, and I'm excited. I get to meet Karen. Now, Karen and I have met, remember, in the oddest of places, Orcas Island, the middle of nowhere, right?
Middle of nowhere. We happen to be there at the exact same time.
Who would have thunk? I mean, seriously, what are the chances of that? So for those of you that don't know where that is, it's off the coast of Washington. It's a beautiful, just spectacular island in the San Juan Islands. And my kids just happen to go to camp there every summer. They do the kayaking camp, or did. And Karen was there on vacation. So we got to meet up in real time one time. So this will be the second time we get to meet at Fancy. So guys, let me know if you'll be there. And oh, good. Yay. It looks like Monique is a yes. That's fabulous. Yay. All right. So let's kick things off. I'd love for you to kind of describe your backstory a little bit. How did you become so passionate about this topic? Again, you were doing it before it was really a thing. So I want to hear, just like, what was that trigger? How did you get to where you are today?
Right. Well, I think like anybody else, as soon as you knew they existed, you wanted one. Right?
Yeah.
And I had been out of practice for a while because I had taken some time off to homeschool my kids. And as I was getting back into things, I was getting an earful, and I heard about these continuous glucose monitors. And since historically I'd always kind of worked in this area, I thought, oh, I would love to have one of those. Wouldn't that be great to use with patients? But I'm sure I can't get one. I'm sure I need a prescription. I'm sure it's too expensive for me or my patients. And then of course I started listening to all the other biohackers talk about using them. Again, I thought, well, that's great for those. Nice for you, buddy, but I'm not gonna be able to do that. And then one day I was at the gym. I was sitting at the gym in between sets trying to build muscle like all of us middle-aged women do. And I see this ad on ESPN for Freestyle Libre. Here's a free trial. Sign up for your free trial. I'm like, free? So I stopped and I got my phone out. I'm like, I'll do a free trial. And I'm like, there's a catch. This is easy. And I get on there and I look. I'm like, I got my free coupon. I could go get a free one at the pharmacy, but it said, oh, but you need a prescription still. I'm like, oh man. And then I thought I would just I thought I would ask. So I texted my doctor, who's, a colleague and a friend as well, fortunately. And I said, hey, would you write me a prescription for one of these? And she texted right back, sure, I'd write one of those for anybody.
Oh,
and
wow.
I'm lucky because my doctor also has functional medicine training. So, and she's awesome. I said, okay, great. So she wrote it. And then I just went and I picked up my first free Freestyle Libre. And that was it. That was it. And I thought, I need to get training for this. Of course, I'm like, how do I use one of these? And I'm searching, and there is no training for me available. It's all for endocrinology clinics. It's all for people supporting insulin. There was no formal training. So I just had to embark on, how do I figure this stuff out?
Okay. So you had to create the training because there wasn't anything, essentially, right?
No, there wasn't. And even if there was training, like every now and then I'll see a free training or a free CEUs. They're generally training on just kind of how to use it in general, usually for diabetes, but it's not training on how to interpret it. Because this is still the case today, that not many people have a lot of experience interpreting data for people who aren't on insulin. Certainly not with prediabetes, or like we haven't been tracking continuous glucose data for non-diabetic and pre-diabetic individuals. We just haven't been doing it. And it's not straightforward. And it's not straightforward because, as probably everybody listening to this knows, your blood sugar responds to so many different variables, not just what you eat, your exercise, stress, sleep, inflammation, medication. There's so many things. And then some people can have insulin resistance. Some people produce more or less insulin. Just your average Joe on the street could have a delayed insulin response. And so it's not something you can just put in a publication and say, this is how you interpret it.
Okay.
It's a lot more nuanced than that.
Well, I can attest to that in my own very limited experience. N equals 1, me, right? Not working with clients, and I know that you and I chatted about some of my data, and frankly, I would have been stumped, with some of it.
Why is that?
Well, I don't know if you remember this, but there was a Friday night where and remember, you could see my data. You were like, I don't know what you did Friday night, but it was ugly.
It's always Friday night.
Friday night, right? And what did I do is I had Mexican. Okay. So I ate Mexican, which really threw things off. And I probably ate a bunch of wonderfully delicious chips first, right? And then had enchiladas, and they were so delicious. So yeah, it just turned out to be a big mess and a glycemic disaster. But the really interesting thing that you noted that I don't think I really would have paid attention to is not only what happened immediately after, or a couple hours, in that time frame, but also how it impacted my nighttime blood sugars. And
Yeah.
that was not pretty either.
Right. Right.
So the note to self for me moving forward, well, I had to change a lot of things.
Yeah.
So like corn tortillas really are not my friend.
Mhm.
Chips definitely are not my friend. Yeah, I used
Yeah.
to, I'll admit I used to be that person that would just grab gluten-free toast, peanut butter and jelly in the morning, and I was good to go. And for me, the challenge was not, oh, I got to change my ways because I want to lose my gut.
Mhm.
There's always room for that, but that wasn't a primary driver for me. So I just didn't know, right? I didn't
Mhm.
know that I was getting those big fluctuations. And
Big
I
swings.
was that person after I have like the toast, peanut butter and jelly, it would shoot way up and then come crashing down,
Right.
crashing. And I just never put it together without seeing the data. So the
Right.
data
The
it is
data.
a game changer.
Right.
Right? Absolute. When you see it, it is I just think it's so powerful.
Mhm. And how many times do we have clients where, we're looking at their diet diary and say, that breakfast you're eating,
Yeah.
I think it's not good for your blood sugar. And
Yeah.
like when you say that to somebody, especially to someone in our generation who, we grew up on cold cereal. Cold cereal with skim milk and orange juice. That was a healthy breakfast. And
Mhm.
that you don't just like flip that messaging in just with one dietitian, one,
Right.
healthcare provider just saying, I don't think that cereal's doing you any favors. They're like, mm-hmm. Until they actually see the data and they go, oh my gosh, that cereal was a
Yes.
problem for me. Like,
Yes.
oh, interesting.
Yeah. I
They're
think
like,
it's so powerful to see it. And then when I saw the data, I was like, "Oh, yeah, I do get a little sleepy." Don't ask me why I didn't put it together before.
right,
I just didn't.
right.
And the truth of the matter is in my head, I was like, "Okay, all right, I know. So gluten-free, it's really good gluten-free bread, but
Mm,
it's, I have peanut butter. So how bad can that be?" Right? So
mhm,
I'm thinking I'm combining somewhat, but the note or the takeaway for me is it's the order of
mm.
what you eat, right? It's not like, and again, I know everyone responds differently, but for me, I learned that if I'm going to do something like that, I need to have a good base first, right?
Right.
Preferably protein
Mhm.
to prevent
Yeah,
that huge, spike and then subsequent crash.
right.
And
And I
then
mean, you nailed it. You
I
nailed
did,
it there, like, for
yeah,
you, because, the data actually helps you know that because there's always a lot of just general information about like, eat this way and don't eat this way, and this is helpful. But every person is still really different. And so for you, that works. For someone else, that might not be enough. But
mhm,
why would we don't want to ask our patients to do more work than they have to. That really
mhm,
fatigues them. They don't want to make their health their part-time job. They want to get on with it.
right,
So it's nice for them to see, okay, this works. It's why we get into integrative and functional medicine, functional nutrition, is because we want that N equals one. What works for you?
yeah, that's true.
Yeah,
Yeah, that really is true. So, so kind of back to your story then. So you got a free sample or an
I got a free
opportunity to
sample.
try it out,
Yeah,
and you saw for
yeah,
yourself the power of this
yeah.
tool.
And then I got on. So a couple things became so customer service. Abbott's
Mhm.
customer service became my best friend. I don't know how they felt about that relationship, but that they were my best friend. It was a one-way relationship, and I learned a lot from them because I had a lot of questions. I didn't even understand. Off-label prescribing. Is it reasonable to ask doctors to prescribe this to people? The legalities. What did they need? What are they liable for? That I learned that from them. But then a lot of my learning came from I just did a beta group right away. I asked, a handful of my clients and some friends who I thought would be keen. And I had helped them all get a couple of continuous glucose monitors. And we just met every week on Zoom for 2 months.
Mm.
And that and I say, no, I want to look at data and then I'll give you my best advice. And we worked on it together. And that's where I got my first big bulk of data, and you think it's surprising when you look at your own data, then when you see the variety of people and what they've got going on, it's really interesting.
Yeah.
And I did find, and I remember, looking back, even, how it is with your practice, you think, oh man, the advice I was giving 10 years ago, oh, I wish I could go back. And it's the same way with this. When I first started using it, I remember seeing people and going, oh, blood sugar doesn't seem to be an issue with you. We don't need to use the CGM anymore. And
Ah,
then,
okay.
yeah. And the more I used, because I thought, well, that's normal. That seems normal. The more I used it, especially when I would use it in groups, when people were stuck with me, where they were doing a 4-week group program. I'm like, well, you paid, you're here, looks okay to me, but let's play around with it a little bit. Some people found that actually when they tighten things, because I would say tighten things up and then see what happens. Is it worth your effort to
Mhm.
tighten up your blood sugar? And then lo and behold, many people found that when they tightened it up, things like, wow, my sleep is really improved.
Ah,
And I
okay.
haven't taken ibuprofen all week, or I'm
That's
not
what I was
having.
gonna ask you about, because there's not
Mhm,
a lot of data,
mhm.
at least that I know of, and certainly it goes against the how we
Right.
were trained, right? And
Yeah.
we have those conversations frequently. Um, but in terms of like it, I don't know how to say it other than in mainstream medicine, perhaps, or
Mhm.
just kind of our mentality, it's kind of black or white, right? In terms of
Yeah.
either you got diabetes type 2 or you have pre-diabetes, but if you don't worry about it. Like, why would you be thinking about blood sugar?
Right. And obviously there's a reason we have cutoffs for
Mhm.
diagnosis.
Sure.
Otherwise,
It would be
practitioners would be in decision-making fatigue instantly, halfway through their day.
mhm,
But I know that I've had patients come in with a type 2 diabetes diagnosis. They had just got their diagnosis. And
mhm.
within 4 weeks, just by tweaking a few things, they're solidly in pre-diabetes. They wouldn't get diagnosed with diabetes anymore
Okay.
just by, moving some things around, doing a few hacks. And for some people, it's that easy. Not everybody.
Okay.
Um, yeah. So I think the nice thing about those cutoffs is those cutoffs for pre-diabetes or type 2 diabetes are timed where you get in and look a little more closely.
Okay. I love it. So, is there data now, to support doing this process with, people that aren't even in the pre-diabetic
I
category?
don't I don't think so.
Okay.
There are some things published about it, but
Mhm.
to that, every now and then I'll see an article come out where someone's interviewed, an endocrinologist, the president of the American Endocrinology Society or whatever, and still I still hear the language of, we all use, actually a very recent article. The person being interviewed said, back when the CGMs came out, we were all using them at a conference of other endocrinologists. And, we all put them on, and, we all had them on during lunch, and everybody was freaking out because their meal took them up around 200. So that's perfectly normal. That's perfectly normal for that to happen.
Mm, mhm.
What I thought was interesting about that was, if I'm thinking back to medical conferences and what they serve for lunch, and you're putting them into the bodies of, if they're endocrinologists at a conference, dudes in their mid 50s,
Right.
sedentary people, statistically 50% of them will probably have type 2 diabetes or pre-diabetes. So probably, so I mean, are we looking at an ideal population? Is this like, oh, it's totally normal, all of us endocrinologists sitting down with our sedentary lifestyle, eating this roll and conference lunch and coffee and 200, so that should be fine. I don't totally buy that. And
Mhm.
when I hear people interviewing endocrinologists who are awesome at what they do, but they haven't seen any data on people with prediabetes or without diabetes. That's not their zone of genius,
Gotcha.
right?
Okay. So let's go back just briefly to the benefits that your clients are experiencing,
Yeah,
even if it's outside of, pre-diabetes, diabetes. So
yeah,
like this other category over here, what are you seeing
yeah.
specifically?
So I still work with a pretty wide variety of people,
Mhm.
and I think so. There's a few different categories of the benefits that they see.
Mhm.
So I'll say that people who have a diagnosis, so they have pretty far along prediabetes or early on type 2 diabetes, especially early on type 2 diabetes. When I get people like that, I get people who feel really out of control. They don't know what to do.
Mm.
They've got their PDF from their dietitian that tells them the general scope of what, eat these things.
Mhm.
And they're doing that, but their A1C isn't changing and
Mm.
they're scared, and they don't know what to do. And so what I see for them is first and foremost, they feel like they have control over things now.
Mhm.
They see the data, they see what's going on, and it's right away. It's a hot mess. It's always a hot mess those first few days. They're like, "Oh my god, look at this, but this is what I'm eating." And of
Mm.
course, like what we'll talk about is even with the new over the counter CGMs, there's a back end to those where I can and where providers can actually follow their clients and we
Yeah.
can see their data and we can see what they've logged. And then when we're on our telehealth appointments or in person, we can share our screen and we can show them, okay, so these, and then this is where you had this, and this is where you exercised this and this. And so
Mhm.
you can say, okay, wow, Friday night looks crazy. What was going on? Let's look. Oh, uh, anybody's blood sugar would look like that if they
Okay,
ate that. I don't know
okay.
if it's you. It might be a little bit you, but it's not you, it's me sort of thing. So let's just change that dinner, change the time, and that's where the practitioner's knowledge comes in, that art of consulting, that art of
Mhm.
patient care. And why don't you try this? And then as they learn more that, oh, every single thing I had on my plate was starchy and none of it had protein and there was
Whoops.
n- and there was no fiber. And so some of it is also just garden variety nutrition that you would
Mhm.
know, but having that data gives you a place to start
Yeah.
where you can see what's going on. And then when you can make suggestions, and then immediately they see, in the week between visits, they can see, oh, I did this and it looks great. Like it all stayed under 140 and I felt good. I'm going to do that again.
Mhm.
And then they do it again and it's good. So it's it's gamified. It's
Yeah.
game and it feels really great. They feel empowered. And then they have a stressful day and they're busy and they go have the same old usually meal and it's up again. And I'm like, oh crap. And so, but now they have some control, they have some agency and they know what to do. And so then every visit with you, they're like, okay, I did this, but I really fell off the wagon. And then you have then it becomes a coaching relationship instead of, I want you to eat this and this and this. They're like, oh, I fell off the thing. Like, what caused you to fall off the wagon? Like you could actually go like, wow, you did. Yeah. Yeah. Thursday night was like, what's going on there? What was happening Thursday? Like,
Right.
oh my God, Thursday was this and this. And then I'm like, all right. Does that happen every Wednesday, Thursday? Like, oh, like clockwork. Okay. Let's meal plan for Wednesday, Thursday. Then you know what to do.
So good. So, and I do want to dig into the new
The
over
new
the counter
stuff.
CGMs.
Hmm.
Before we dig in, I just want to ask about the connection with the microbiome.
Okay.
Just
Yeah.
curious about that. Is it all about acromantia?
Um, I don't know. I mean, clearly their acromancy is a thing. Just stop messing with my hair. Clearly acromancy is a thing. The gut microbiome is definitely a thing.
Mhm.
And I'm actually yeah, this is kind of handy. A lot of the research that's been done has been pretty clear that the microbiome does influence it.
Mhm.
But whether it's acromantia, I am not an expert at this. So
Okay.
let's just put that out there. I'm just going to talk about it.
Mhm.
I know, like one article I'm looking at here from Cell Metabolism. Uh, this is a 2024 article in Cell Metabolism about like statins aggravating insulin resistance through blood glucagon like peptide in a
Mhm.
microbiota dependent manner. So in this one, they actually came down on the side of Clostridium species because they showed that statins, because we're always like, God, do statins cause diabetes? And if
Yeah.
they do, how? And in their paper, they showed that the statins were interfering with the diversity of the microbiome.
Oh, okay.
And one they looked at was Clostridium
Okay.
species.
Hmm.
And then through, they looked at this in humans and in mice, and they were showing that, if they repopulated with Clostridia species, they could ameliorate some of those negative impacts of the statins.
Okay. Yes.
And if they gave some bile acids like TUDCA,
Mhm.
that would ameliorate the effect. So it seemed to be, probably and those secondary bile acids are, of course, produced by microbial action.
Mhm.
So it seemed to suggest that there's something having to do with maybe secondary bile acids and, of course, the effect of the microbiome converting primary to secondary bile acids, that maybe that was a mechanism there.
Okay.
But they did seem to find that it was the microbiome connection with the statins. So that just gives more weight to the impact of the
Yeah,
microbiome on
that's
blood sugar
fascinating.
control. And
Okay.
I think a lot of that then and I think that influences your production of like GLP-1 and GIP.
Aha. Okay.
So it might be
Cascade,
through all of that stuff.
right? Okay.
It is fascinating.
So tell me, let's talk about the new over-the-counter CGM. So
Yeah,
exciting.
so
The big
exciting.
question is, do you feel like they're accurate?
Mhm. Yeah, they're the same hardware.
Same hardware.
So
Okay.
so let's start at the beginning. There's 2 new continuous glucose monitors on the market, maybe 3, but let's say 2 for now. Um, Dexcom released their Stello. I've got a box of that here. They released their Stello. That came out in August.
Mhm.
And then Abbott came out with the Lingo, and I think they're coming out with a Rio too, but they have the Lingo.
Okay.
And these are things you just go click, click, credit card, bam, ships, lower 48 states. It's there, in a day or 2. It couldn't be easier to order one of these.
And
And
what's
they're
the price?
hmm? The
I
price,
know the price for the Stello is like 99,
if
I
you
think.
don't get a subscription and you'd order a month's worth, and it's
Mhm.
$99
Okay.
for 2 sensors that last 4 weeks.
And what about the Abbott? I didn't even know Abbott had one.
The Lingo, you can buy one for $49.
Okay. So like 2 weeks worth of
Yeah,
data.
yeah.
Okay.
So it's
Cool.
still about $100 for a month.
Gotcha. All
Yeah.
right. And no
And
prescription, which
from
is
what
amazing.
I can say, no prescription at all, just click, credit
Mhm.
card, come, and I think they all take FSA, HSA cards,
Okay.
so it's pretty straightforward. Yeah, I've there's strengths and weaknesses to both of them that I've seen. I've been using the Stello for a couple of months, and I'm already supporting patients using the Stello, so I have a lot of experience with that so far.
Mhm.
The Lingo is only available for people with an iPhone, which I don't have,
Okay.
but my assistant Amy she has an iPhone, and Amy's using one, so she's trying that out. And I use Facebook groups. I have a Lingo users Facebook group, so we can all talk about how they're being using. And and then a Dexcom Stella Facebook group, because if there's no training for you, you need people. So I like to crowdsource that. And
Mhm.
so far, what we've seen is that these continuous glucose monitors are no more or no less accurate than the regular Libre or Dexcom. The MARD, they call it MARD. It's the same. And they're prone to the same inaccuracies as those,
Okay.
meaning, every now and then you get a dud.
Okay. I was gonna ask you about that.
Every now
Mhm.
and then you get a dud. Typically, when you put one on, the numbers aren't super accurate for about 24 hours. They always call it the warm-up period, that you take it with a grain of salt. Sometimes toward the end of its lifespan, it also runs a little wonky.
Okay.
But I find that with the G7, the Libre 3, and any CGM, and temperature, some medications,
Hmm.
pressure. If you lay on the sensors, they all work using an enzyme that's oxygen dependent. So if you squish the skin around it, you get a false low reading.
Okay.
So
Okay. Interesting.
it's the same. It's the same for all of them.
Yeah, because I remember, and I think I texted you. I was getting readings like 53, like And not just once,
Right.
like numerous times, the alarm just kept going off.
Oh, the alarms.
Oh, the
But at
alarm.
night, right?
No, it was middle of the day, actually,
Oh,
it was happening.
oh, it was just
I
it was
don't
just
know.
off.
It must have been because I did not really feel any different, so I'm just
Yeah.
guessing it was, yeah, not accurate. I must have gotten a dud that time.
Yeah. Yes, and you do, and you know what, and that actually goes to providers, there's a lot of people, so people have been getting a CGM and using it on their own, even
Mhm,
when they got a prescription. And now they're going to be doing it. Now they are doing it in droves. And the thing about using it by yourself, and I see this when I'm lurking in Facebook groups of people with diabetes, without diabetes, to see what their experiences are.
mhm,
People get frustrated with this technology because they don't
mhm,
understand the 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 nuances of it,
mhm.
just the technology, and they don't understand how to interpret it. So it puts a lot of people off and causes a lot of people stress.
Oh, yeah,
Nothing causes them stress like the damn alarms going off
yeah.
all the time.
Turned off, most of them, right?
Mhm. Yeah,
Yeah.
so when you're using the Libre 3 is what I often would support, but even Dexcom,
Mm,
you can adjust those alarms, and that's like the first thing we do as providers is, you know, okay, before you even put this on, let's smooth out those hurdles in front of
yeah.
you. You wanna make sure they just don't have the friction because they're gonna be happier. It's why they're paying you, to reduce friction. And one of the things is to get those alarms off. But the over-the-counter CGMs have no alarms
Oh, okay.
because they don't have to. The
Right,
alarms are there for people using insulin to prevent, fatal
right.
hypoglycemia.
That makes sense.
Yeah,
Okay.
yeah.
Um, so yeah, so do you get many patients where the data is causing anxiety and food fears? Like,
Yes,
even
all the time.
okay, it's really interesting because 'cause I've even spoken with some dietitians
Mhm.
who try it on themselves, and it kind of gets them worked up.
It
It's
does.
super, super interesting. Instead of just
Yeah.
kind of looking at it as data, I don't know, something goes awry. And
Yeah, we call that the dietitian syndrome in my
aha,
circle.
aha, okay,
Yeah.
yeah,
No, it's really common, and I think, and I'm not immune to that either, and I think it's because this is all really new territory. So
mhm,
back to when we were talking about how, we just don't have a lot of we haven't been looking at data for people without diabetes or with pre-diabetes on a
mhm,
continuous glucose monitor. So what is normal? And when do we freak out? When is it a problem?
mm,
Even if it's higher than normal and we're like, boy, this could be lower, you could do better than this.
yeah,
We're still, you still have to put it into the big clinical picture.
mhm,
A lot of people, I love the saying, don't treat the lab, treat the patient.
mhm, that's
When
good,
you're looking at a lab, like let's say you're looking at a stool test, and a typical one these days is, oh, got a little H. pylori in there. And like if you do a stool test, it's not really high, no virulence factors, but there's a little H. pylori, and
mhm,
people are like, oh, we got to kill that H. pylori, and that there's a school of thought there that says, H. pylori is all over the place, and even if you get rid of it, they're going to go make out with some dude who's got it, and then they're going to have it again. Is it causing a problem? Is it causing a problem for your patient?
mhm, mhm,
Is it a root cause?
mm,
Think about that before you go in for hundreds of dollars of treatment and inconvenience them and do that. And the same thing with blood sugar.
mhm,
I still sometimes I'm like, is this worth bending over backwards and stressing to fix? Is this something we need to fix?
right,
Yeah. And I think when I going back to dietitians using it, whenever I am mentoring it, because I'll do training. We have a monthly webinar series now of how to interpret continuous glucose monitors because I've seen people really want that support and they need it.
mhm,
The first thing we do is, of course, I want them to use a CGM themselves because then it's easier for them to support their patients. And everybody wants to use one. Like, do me, do me, do me. It's like a horoscope getting done. Um, but they freak out because you've got dietitians eating really well generally and
yeah,
having good health, because this is a highly educated group of
mhm,
people, very motivated, doing all the right things, and they put a CGM on, and it's higher than they think it should be.
Yeah.
And this is what happens. Their stress levels go through the roof.
Oh gosh.
And the more they do to improve their blood sugar, the higher their blood sugar goes.
I think, is
That's
that
the dietitian syndrome.
cortisol?
What's that? Yeah,
Is that
cortisol.
called cortisol? Yeah.
Yeah. But like I said, people, I think in our profession, especially highly educated, highly motivated women, that's our superpowers, that we can just bring it.
Yeah.
But it can
Mm.
get in our own way sometimes. And
Yeah.
that's what's happening. And I mean, we've done it. I've had one dietitian, I like to tell the story, who just couldn't get her fasting blood sugar under 105.
Mm. Mhm.
So that's a problem. Of course, low triglycerides, no signs of insulin resistance. That, you
Okay.
looked in the whole clinical picture. To me, not a freak out moment. I was thinking, maybe she's just, high strung, a little stress. This isn't going to be a big deal. If this is the only thing she has to worry about, cakewalk, take off the CGM. But what we did is we did some relaxation practices. Like she
Mhm.
did a Viparita Carni, legs up the wall, eye pillow, set the timer for 10 minutes. And then we watched her blood sugar start to come down.
Oh, that's wild.
And
Okay.
yeah. And now I'm kind of like, okay, and I see the role of stress and playing
Mhm.
in blood sugar so often that, I just think you can't rule it out, and you can't underestimate the role of stress, whether it's just a acute stress or chronic stress, worrying about things, worrying about packing for fancy. It's all going to affect your blood sugar.
Okay. Yeah. I remember one time, I had a CGM on and the smoke alarm went off. And,
I think I saw that data.
yeah. Oh, right. I think I did send it to you. It was insane.
It was insane.
And in the moment, I was like, it's just so shocking. And it was so loud and my dogs were freaking out and, it's so stressful.
Mhm.
And then I went back and looked at the data. I'm like, what happened here? Like it took a minute before I
Mhm.
put it together. I'm like, oh, that's when the smoke alarm went off.
Yeah.
Oh my goodness.
Yeah. And so, I mean, I at least once a week, usually twice, my role is to talk people off back from the edge.
Okay.
Somebody is really freaking out and really worried. And my job is to look at their labs, we look at the
Mhm.
clinical picture, and I go, and I show them, and I'm like, you know what? When we put this in a context of everything else, I don't see a problem.
Okay.
Because if people are listening to us, we're saying prediabetes isn't pre anything. It's the tip of the iceberg. Under the surface, there's insulin resistance and metabolic damage and blah, 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 blah,
Mhm.
blah. And that's true for a big chunk of the population.
Mhm.
But you'll see a lot of people, especially like us, who that will start going up for different reasons.
Okay.
And it's important to let those people, that's a new situation. Before, we would have never known that was going
Mm-mm.
on.
Mm-mm.
And so until I have a good reason to cause alarm, our job is to, I don't see a problem.
And
I
what
do
labs
not,
are you looking at? Like
I'm
to
looking at,
say,
to confirm. I'm looking at overall, waist circumference. If I have a DEXA
okay,
scan or something, I would love to see visceral adipose tissue.
okay,
But easy one, triglycerides.
okay,
They've always got triglycerides. If they're over 100, I'm looking at blood sugar.
okay, all right.
And fat, I can always do a fasting insulin. That's always good.
Yeah,
So those are the great ones to use.
okay,
And then, are they getting hangry? Do they have other, is their blood pressure going up? You look for the signs of metabolic syndrome, basically, the signs of metabolic syndrome. And if none of those are present, and I have someone who I think, and this is really important, I think stress, their stress bucket is a little too full, and that's what's getting in their way. Every day I see ads, people targeting peri and postmenopausal women, stress and that menopause belly, blah, blah, blah. It's cortisol, blah, blah, blah. When you get a patient and you can see that their picture is elevated cortisol, and that's why they are losing lean body mass and putting on extra fat mass, and they're fatigued and their hormones are imbalanced. And then you see their blood sugar, that's where you have the opportunity to say, okay, let's use this data for good, not for evil. Let's
mhm,
use this data to say, wow, stress is actually impacting your blood sugar. So, one, let's not freak out about your blood sugar. But here's a great example. Let's give a concrete example. You have a woman who's 55 and she's been doing intermittent fasting in the morning.
Okay.
She drinks her coffee, she does her workout, and then she has her first meal at noon. And she's been doing this for like 5 years, and she's been putting on weight even though she's doing all the right things.
Mhm.
And you're in the back of your mind going, this is so cortisol, this is so stressed. How do
Mhm.
I relay this? You put on a CGM and you see that her black coffee takes her blood sugar. Like she wakes up and immediately, she gets that bump that
Mhm.
looks like the Dawn phenomenon. This person doesn't have diabetes. This person doesn't have fatty liver. You've looked at her liver panel. There's no sign of that.
Mhm.
And then that coffee takes it up even more. They're like, it's just black coffee. What's going on? What's
Okay.
going on? And then I'm thinking, okay, that fasting and then adding coffee is just sort of adding to her stress
Mm.
bucket. This might be someone who needs to pull, maybe get some protein in before they have their coffee so that it evens out, so that, the fasting and the coffee isn't doing that. And so that's a way that I've used a CGM in someone like that to identify that actually it's stress and cortisol.
Okay.
And the data, I can use that data to show them that it's the stress and the cortisol and adrenaline release from the coffee that's making it worse. And we never take away the coffee. I don't know about you. It's the first thing I learned in diet therapy in grad school. Don't take away the coffee. And so we just put it in order, have some water, have some protein, have your coffee.
Okay. That works. What about sleep disorders?
Oh
Really want
yeah.
to talk about that. And I did see your post. You yourself did a sleep test, right? And I
Yeah.
think you were talking about that. So, yeah, tell us, yeah, sleep disorders
Sleep
or any
disorders.
other causes
Yeah.
that
We
yeah.
talked a lot about this in my the September webinar of interpreting CGM. We talked about stress and sleep and how to interpret that. And of course, you can't diagnose sleep apnea or sleep problems with the CGM,
Mhm.
but there are patterns that we see in there. Um, for example, the typical pattern of your blood sugar is that, you like say you have dinner at 6 o'clock and it goes up, and then your blood sugar comes down, hopefully before you go to bed. And that's just what I always advise my patients, bring your blood sugar down to baseline, whatever that is for
Right.
you. And then you go into sleep in a fasted state. It improves your sleep, improves your blood, improves all the
Okay.
things. And so let's say they get down to 95, but sometime during the night, they popped up to like 110, 120, and they stay there. And in the morning, they're up around 120.
Okay. Mhm.
And even they're not eating and they stay there. And then they eat something finally, and they get a little blip from eating, and then it finally comes down.
Mhm.
When I see that routinely, I'm like, why is it going up in the middle of the night? It's often poor. I always ask, how are you sleeping? Maybe
Mhm.
you have sleep apnea. I did this to someone in a chat the other day. I said, maybe you have sleep apnea? Sleep apnea. If I had time to have sleep apnea, maybe I would, but I'm not even sleeping. Like, well,
Oh.
now we have our answer. Because when you're
Ooh.
not sleeping, your cortisol level goes up. That
Mhm.
causes your blood sugar to go up. And there's something about when cortisol, that causes your blood sugar to go up because your liver is going to be kicking out more, and it's caused insulin. Cortisol causes that insulin resistance. It just causes that perfect storm. You don't have that insulin bringing things down
Mm.
because you've been fasting. But as
Mm.
soon as you eat anything, as soon as you have something going through your gut, that triggers your gut peptides that tell insulin to come on and deal with that. And then that will bring things down to baseline. And that's when I see that routinely, that is when I ask someone about their sleep. And then, we do some easy, I'm like, how was your sleep? Do you snore? You ask those questions, trying
Mhm.
to see if they have sleep apnea. And then I send them a link and ask them to do a home sleep study.
Okay.
And that convinces them.
Mhm. Now, would you for sleep disorders, I don't know if you know the answer to this, but would your heart rate also go up typically?
Oh,
Just
that's a really good question.
Mhm.
I think it would,
Okay.
but I haven't looked into that enough. Yeah,
Yeah,
I would think it would,
I
because
thought
tracking heart rate is so nice for that.
yeah, because yeah, I have lots of people I know that, do that at night and they're like, "No, that can't be it," you
Mhm.
know?
Or their HRV.
Mhm. Yeah.
But I'll tell you, I have a fantastic HRV. because I was tracking that. I've blown through 2 Oura rings already, so I'm not tracking it right now. But I think we all have sort of our baseline. Some people naturally have a lower or a higher HRV, and then it fluctuates. And I have a naturally higher HRV and a naturally very low heart rate, despite not being a world-class athlete. And I have sleep apnea.
Mm,
Turns out I have mild sleep apnea, and I knew it. I snore like something crazy. So
okay.
don't share a room with me in a hotel ever.
Okay.
So
No,
you never
sharing a
know.
recipe.
Yeah, I'm not the picture of sleep apnea. You always think, oh, that's someone
Oh,
overweight, old,
right.
old big guy. Um, nope, little
Never my
petite
best.
55-year-old me, snoring like crazy, having a little sleep apnea at night.
Wow.
Picks up a
So
lot after menopause.
are you treating that?
Not yet, but that's my currently looking into that.
Okay.
I mouth tape, which has helped me a lot, but it's getting to the point where I'm starting to look at other things. And that's why I
Yeah,
did a test early on, because I know how it takes a while to sort of dial these things in for yourself.
sure.
So I thought, let's start the process now so
Yeah.
I can have it
Yeah,
really processed.
I know a dentist in Illinois that does the mouth guards
Mhm.
that
Yeah.
kinda, opens the airway.
Yep.
That works for some people, other people not so
Mhm.
much, so
Yeah. And my dentist was the one who he said, I can make you one of those, but you have to get a diagnosis. So get a sleep test first.
oh, okay. And,
My dentist appointment is
what
next
is the
week.
name of the company that you use? I
I went to own sleep medicine. That's
okay,
my doctor referred me to them. My insurance didn't cover it. I'll put the link here in the
but
chat.
it's great that you can do it at home
Yeah,
because going
and
to sleep,
yeah,
doing a sleep study, oh,
yeah, and I did a YouTube. Put out so much stuff. I did a YouTube video on it to show people what to get, because
that's
sometimes you don't do one because you're scared. I'm like, oh, I don't want to do
that
one of these.
was great.
But so I put it all on the video so you could see what I had on, and I'm a princess with my sleep. I'm one of those people, I have all my things, and it's gotta be just right, so I sleep. I was fine. It was fine, and
Oh,
I paid cash because my insurance is crap, and I think it was like
mhm.
$135.
Oh god, that's amazing.
Mhm.
Okay. We got a couple questions. Hey,
Oh,
Julie,
shoot.
on, this is on Instagram. I don't think you can see those questions, Karen. So Julie, um, so I think Julie's asking, and I think the answer is no. Can you get it in the drugstore? These over the
No,
counter. You have to
no,
go to the websites,
you have to
right?
go to the
Okay.
websites.
And then do you recommend a CAR, that stress bucket?
Oh, yeah, for cortisol. Yeah,
What is
yes.
that?
The cortisol awakening response. So
Hmm.
you get the 4-point salivary cortisol, first
Oh, oh, oh,
thing,
oh,
kinda start like,
gotcha, gotcha. Okay.
you know what it is. Yeah, it took me a minute. Yeah, you can do that. I'm really conservative when it comes to labs. How techie I am. I'm like, it takes nothing for me to slap a CGM on somebody. Um, but yeah, I think a cortisol awakening response can be good. I
Okay.
rarely see them totally out of whack.
Mhm.
Uh, yeah, but when I have, boy, is that handy.
Okay, so I have you. I'm just gonna ask. So I had, and we got a couple questions coming in. I'll just ask you really, really quick before we wrap up. I did a Dutch test, and
Hmm.
come to find out that I don't know how they determine this, but like my cortisol release, I guess, is okay, but I'm not excreting it. What do you do for that? Just curious.
That's a good question.
What do you
I
do
can't
for
remember.
that?
I somewhere in the back of my mind, I've read that, but I think, yeah, how you get rid of it.
Usual, but I don't know.
Yeah,
So,
yeah,
funny thing is I never really got to the bottom of, okay, well, what do I do about that? I
yeah.
don't know if it has to do with my
You're not
detox.
metabolizing it. You're not metabolizing that cortisol
Exactly.
properly.
So it's just
Yeah,
kind of floating around.
yeah.
Anyway, all right. If anyone
Lindsay
knows,
has a question. This is a good one. She wants, can I talk about Stello downloads, how they download their data? I heard they only log data every 15 minutes. Lindsay, this is a really good question. Stello, Dexcom intentionally. So it still samples data, I think, every 5 minutes. They're always 1 to 5 minutes. The
mhm,
sensor will sample. But I think Dexcom intentionally decided to only display a change every 15 minutes because that would just alleviate some of that data fatigue that people have. I
okay.
don't know if I agree with that decision, but it is what it is.
Mhm.
But the data every 15 minutes, you will get the every 5-minute data that refreshes on your phone.
Okay.
But here's something that's really important about Stello in terms of providers using it. Oh, and here's something that's important to know when you're thinking about which should you use in your practice, Stello or Lingo, if you want to use these. You can't view the data on Lingo.
Oh, okay.
If you've used Freestyle Libre or before, you'll know that the back end of that is LibreView, and they can share your data and you can view it. It's great.
Mhm.
They did not provide that pairing. Abbott has not provided that pairing. They told me they didn't, and I just checked anyways in case they were wrong, and we can't figure out how to pair. But
Okay.
Stello is connected with Clarity.
Oh.
Clarity is the same back end that G7 and G6 use. It's a bit of a thing to do the pairing, but I actually have a webinar. Actually, the October webinar and all about CGMs that I do. That's going to be all about Stello and how to incorporate it into your practice.
Oh, good, good, good.
Yeah. So I'll show you how to pair it with Clarity because, when you're doing this with patients or even groups, you want it a bit automated. You want to be able to like just push out that information. Please do this and then pair here. So when we jump on our appointment, I've got your data. And so there's ways you can do that, but you can't do it with Lingo. Lingo is fine. It's a good app. It's all right, but it doesn't pair. So it's less valuable for a practitioner to use.
Okay. Awesome. Yeah. So what is the, let's tell people where they can go to learn more about these webinars.
Okay. So first I've got a freebie on here.
Okay.
That I've updated my toolbox for using CGM in clinical practice. So it's got the information if you want to help your patient get a prescription for a Libre 3, because there's still reasons to do that if you have a clinical picture and you need more functionality. And then how to get the Stello and Lingo and then the back ends for those. So that's there. So I encourage you to grab that.
That link that you shared with me.
Great.
Is that it? Yep.
Yep. And then my website will have, let me pull my website up and get that. The information about those webinars. They're on Fridays.
Okay.
Okay, I'll put that in.
Guys, I'm going to post the sleep apnea company. Karen shared that. Is this it? I think.
Is it Own Sleep?
Yeah. Med.com, because someone was asking about that website. So there you go.
And I just gave you the link, Leslie, for the CGM webinars.
Oh, okay.
So that's on my website. You go to my website and it's Hack Your Blood Sugar. HackYourBloodSugar.com. You can find it that way. It's easy to remember. And then under CGM, it's on there. There's a page that's just for supporting CGM in clinical practice. And it's got this toolbox there, and then the CGM interpretation series where we're meeting once a month. And those webinars, I'm trying to make them so that I'm delivering some content. So this one, I'll be telling you all about Stello, and then time for Q&A. And some of that Q&A might just be you saying, hey, I've got this patient. This is what her data looks like. What gives on this? And a lot of people show up to these who are very smart. They might not know a lot about CGMs, but they've got a lot of knowledge to drop. So I'm leaning heavily on the community for that so we can all kind of learn together.
That's incredible. Before we wrap up, guys, I just want to remind everybody, hopefully you can see my screen. Yes, about the Six Figure Biz Academy. Just really quick, we are going to start very soon. So this is your chance. Okay. This is once a year. That's it. So this is it probably maybe until early 2026, actually. So if you are someone that, you know what, honestly, this is the business training you didn't get in school. Simple as that. It's really, I view it as an extension of, like kind of the next step after your clinical training if you're in private practice. So guys, go to the website. It's sixfigurebizacademy.com. And let's just set up a chat, right? No obligation, zero pressure, right? we'll just have a chat. You just fill out this little form, click here to apply now. Just fill out a little form and it'll take you to my calendar. We'll get you set up for a chat and just explore if this is a good fit for you or not. And believe me, I have told people it's not a great fit. So I will be honest. I promise you that.
I got to interrupt here. I did this program a number of years ago, and it is like graduate school for exactly what you need for marketing for an online health business. I loved this, and we are in a accountability group that Leslie puts you in a group with people you meet with regularly. I still meet with that group at least once a month.
Do you really?
And I have lunch. I have lunch with Julene once a quarter, and we're having lunch next week.
I love to hear that. Guys, we get the best group together in this. Well, first of all, I have awesome clients. Let me just put that out there. Okay. Awesome, wonderful, kind, sharing clients. And the people that join the Six Figure Biz Academy are no different. So, the community, I think, is worth the price of admission in of itself. But as Karen said, thank you so much for that, Karen. I really appreciate it. I know I'm a little biased, okay? I admit it, but I do not think you're going to find a program out there. Just the depth of training, just that level of comprehensiveness, and I love putting it on. So let's have a chat. All right. So
it's clearly time to go.
You can tell my time's up. Oh my God! Can you believe that? The howling. Oh my gosh.
Oh.
Okay, I'm gonna put myself on mute. And Karen, you can wrap up, okay?
Okay.
Terrible.
Okay. Thanks you guys for listening. Do get on my toolkit. All your patients are going to be using these CGMs. Figure out how to use them. You're going to love them. And check out Leslie's Six Figure Business Program. I still use her stuff. Like I still have everything I've downloaded from that program whenever I need to do something new, like hire somebody or start a podcast or do a landing page. I'm like, how do I do this? I'm like, oh, wait, Leslie has a thing about this. And I would just like copy, paste, edit, done. So good. So thank you for listening to Live with Leslie today.
Yes. Okay. I'm back. Sorry about the little interruption.
I'm going to head out. I've got to go.
My husband pulled up and, the dogs go berserk. So anyway, guys, it was so good seeing you, Karen.
You too. I'll see you in a couple days.
We'll see you in a couple days. Let me know if you're going to Fancy. Mwah. Bye, everybody. And look up the sixfigurebizacademy.com. Let's just have a chat. Okay. I'll help you out. All right, guys. Take care. Talk soon.